This is an audiosonic massage tool, and these are handheld devices which use sonic waves to treat conditions like muscle knots and nodules, aches and pains, migraines, sciatica, arthritis, neuralgia and much more. But you must always check with your practitioner beforehand just in case you've got any contraindications. They are good for home use and they penetrate up to about 6 centimetres into the skin tissues, so you can get a deeper result than just a manual massage. The vibrations in the device sound like a humming sound, so you have 2 settings on this one. So setting 1 is quite mild, and then setting 2, you can hear that's a lot louder, and you've also got the frequency that we can change on this dial here. And the effects of this can penetrate deeper into your tissues, so it's improving the blood flow and the waste removal at your cellular level. So the main contraindications for audiosonic are skin conditions and diseases, recent scar tissue up to about 6 months, large areas of bruising or cuts and abrasions, any undiagnosed pain, lumps or swelling until the client knows we can't possibly work on an area, highly vascular skin, so that's varicose veins included within that. And you also don't want to work on pregnant clients if anyone has a thrombosis or if there's an electronic implant like a pacemaker or any metal implants. We never work on the spine or on any very bony areas with this tool, but some people think that it can actually aid the relief of any disc troubles, while others think that if you do have a slip disc or any delicate areas there, just avoid it completely. So your best bet is to speak to the client, and if in any doubt, get GP referral. Just don't proceed if you don't feel confident doing this treatment. So what you would do when you're using the audiosonic is do your manual massage on the area, especially if it's the back, warm up the tissues, and then this can be introduced maybe about 10 minutes in. A full treatment could last up to 20 minutes, but it depends on what the client's coming for and exactly what the problems are, if you're looking for knots and nodules or if it's just for relaxation. Always do your electrical safety checks, make sure that any attachments are on securely, and you can check it on yourself first to make sure that it feels okay. Plus, if the client's never actually had this treatment before, when you're in your consultation you could actually ask them if they'd like to try it just on the back of their hand so that they can feel the sensation and see if they're quite happy to proceed with the treatment. So we've manually warmed up the back with some Swedish massage, and we can use the flat attachment just now, which is for the larger areas. So what we'll do is we'll start off just on the lowest setting, and what you can do is just work in one direction. So for instance, we could just very gently slide the audiosonic from the base of the back just up to the neck. And what you'll do is always support with your free hand, and it tends to be that the slower the moves, the more relaxation and also the more effective it is. So just take your time, and it's okay to see erythema because you are stimulating the skin and the tissues. So you just take your time, and always remember not to work directly over the spine or directly over bony areas. If you did want to concentrate on areas that tend to get quite sore, say for instance the scapula, then you could concentrate on just fanning out just to the shoulders, because again this will have a draining effect. And once you have finished using your audiosonic tool as well, you can do some manual lymphatic drainage just to make sure that any waste products or any lactic acid in the muscles is effectively removed. You also find that a gentle heat starts to build up too, and it's quite normal for the client to comment and say that they feel the heat building up. Just be careful if it feels that it's getting too uncomfortable or the skin becomes excessively red and there's excessive erythema present, then stop. So that's a basic demo of how to use the flat attachment for the larger areas, and we'll show you next how to use the smaller attachment to deal with knots and nodules. So this is the smaller attachment. It's more for working in direct areas, specifically areas of tension, knots and nodules. So again, make sure it's securely attached. You can test it on yourself. If you need to adjust any frequencies, then you can change them manually. And what you would do is just support with one hand and just work over areas in very small circles, and it's just helping to release any areas of tension there. It is really normal to see erythema present because we are working specifically over one area and stimulating that. so don't be alarmed. Again, it's just if it goes excessive or very hot that we would want to stop the treatment and let it cool down. You can just specifically work on one area that's causing the client discomfort. So you could go into the shoulders, you can work into the neck, or you could work down either side of the spine. But again, just be aware if there are any conditions. As we said previously, if there's any disc issues, well, some people believe this can help with the pain, others believe that the vibrations could actually irritate it. So the best advice is don't take any chances and seek GP referral. So again, if anyone gets sciatica, any aches and pains in the lower back area, you can really take your time and concentrate. Sometimes you start to speed up your work, but if you do catch yourself doing that, just take a little moment to slow it down, and it's much more relaxing for your client. As we said, don't go beyond 20 minutes, and then once you're finished, you can place your machine to the side and finish off your manual massage, and then just be sure to sanitize your equipment after use and make sure it's clean for future clients.